PSI TV gives the small business a bigger presence by making TV affordable. Beyond ads, biz brands can now have a channel presence with their content. We are the Netflix of biz brands. If you have a passionate message, the solution to a problem, a new book or product launch, and want to impact a new and expansive audience, have your audience say, I saw you on TV. PSI TV is proud to bring you another star, this time in the health and wellness niche. Dr. David Steenblock is the interdisciplinary medical genius taking roads untraveled to find ultimate healing for his patients with a focus on stem cell therapies. With his long line of incredible breakthroughs in the medical realm, he has devoted his career to the diseases which most ail and traumatize the human condition. Known often as the stroke doctor, he is credited with implementing adult, which is non-embryonic stem cells to significantly repair blood flow to the brain, gifting stroke patients with a revitalization of balance, faculties, and a normal sense of self. He founded the Steenblock Research Institute back in 2003, and he has worked with his own practice for regenerative medicine, providing bone marrow therapies for patients with chronic degenerative disease and or interest in anti-aging. He's over in San Clemente, California, and he is the author of Umbilical Cord Stem Cell Therapy. Dr. Steenblock, thank you for being my guest today.
Well, thank you for having me.
Doctor, would you mind showing us that book, Umbilical Cord Stem Cell Therapy?
Sure.
Just give us a quick overview of what we can expect if we do read it.
Well, it gives you a review of the science of stem cells and in general what they are and how they work and some of the cases that have had great results. It was written back in 2006 after my first clinical trials and whatnot, where we showed that in cerebral palsy children, they had significant results with one vial of stem cells. And so that was kind of how my career in stem cells started, was trying to identify what kind of patient would be the best to receive stem cells to prove that they work, because at that time there was no clinical trials and nobody had done any actual work with people like with cerebral palsy or stroke or whatnot. And so once I decided, I went ahead and did that and had great results, and we keep having great results with cerebral palsy. And stroke is a little bit more difficult because they're older, they have more complications and more problems. But you want to, when you're doing the first clinical trial, you want to get the low-hanging fruit and get the ones that are best going to respond, and that's what happened, and that's why we did CP, cerebral palsy, first. But we've had great results with many other conditions as well.
And I understand that book is actually written for people like me, the lay.
Right. It's not a high-tech book. It's got a lot of cases and just explanations that anybody can understand. It's got really good reviews, so you'll find that it's a very readable book and can really educate you. Even though it's an old book, it's still got all of the basic science and everything. Nothing's changed about what we wrote in there. It's still all the facts.
Right. So, Dr. Steenblock, when I was in college, I had the scary experience of attending an autopsy, but you got your medical school induction at a much early age, very, very early age. Tell us that story.
Oh, well, it's people always tell you about, when did you get interested in medicine? I said, well, at the age of 4, I did my first autopsy, and I was a boy on the farm, and the horse, we had these big draft horses, they call them, and one died, and so the vet came over and was going to do an autopsy, and I begged to let me help him do the thing, and he said fine. And my mother freaked out. She thought I was going to traumatize myself for life, and so she tried to drag me away, and we had almost a physical fight over my being able to see the autopsy as compared to going in the house with her and not seeing it. So I guess she was right. That autopsy traumatized me for life because I've never gotten away from trying to figure out why does an animal work the way it works and all of the mechanisms as compared to a tractor, because I knew how a tractor worked. I said I wanted to know how a horse works, and I found that the horse was much more complicated than that tractor ever would be. So I'm still working on the horse and humans basically. So trying to understand it all, because it's extremely complicated, to say the least. You never get bored because there's always something new and interesting to learn in medicine.
Wow. Well, a lot of work has happened in the stem cell area. So give the quick layperson overview of what stem cell therapy actually is or does.
Yeah, a lot of people have not even heard of it after all these years. It's been around, going for 20 years. I thought when I started that there was it was so dramatic, the results that we're getting, that I thought that the medical doctors and the medical profession would just jump on it. We'd have everybody would be doing it within a few years, but they still aren't. And so most doctors don't know much about it still, and most doctors are not doing stem cells. And so, and the patients themselves don't know anything about it. So when you have a bad knee, that instead of going to the surgeon and having a knee replacement, you go to a doctor like myself, get one simple shot, and all the pain goes away, and you're going right back to normal living. Well, that's a pretty simple thing as compared to having a complete knee replacement. So you see a lot of that. We probably get an 80 to 85% success rate with knees and hip joints and things like that. But the point of it, go back to what it is, stem cells are basically how we start in life. We start with an egg from the mother and a sperm from the father. You put those together and you have what is a seed, a biological seed, and that's called a zygote. And from there, that zygote multiplies and forms more cells. And after 32 cells or 64 cells that are made by that particular initial seed, you can take those seeds that are formed and put those into tissue culture, and that's where the embryonic stem cell therapies came from, and that's how they from 2000 to about 2008 to 10, that was the big rage in science. Everybody wanted to do embryonic stem cells because they were so promising. Well, it turned out they were promising, but not promising enough, because there was a lot of problems with the cells sticking together in a tissue culture. And those sticking together cells made clumps, and the clumps fed growth factors one to another, and that produced cancer. And so they wound up cancer. And basically, the embryonic stem cell is almost history as far as being used. Now, they may be able to figure out something, but so far they haven't. So then the next thing was they started getting into umbilical cord cells in about 2000 as well, and that turned out to be very safe. You could take umbilical cord blood and take out the stem cells and give them to anybody, and you have no reactions. There are no adverse reactions. You don't need chemotherapy, etc. So you can see tremendous results with all kinds of diseases that standard medicine still is saying, no, you have to have chemotherapy, you have to have radiation, then we give you stem cells and that kind of thing. And oftentimes you don't need all of that. For example, multiple sclerosis, the standard of care for multiple sclerosis at the universities now is about $160,000. And there's about a 5% chance of dying from the chemotherapy that they use. On the other hand, you come to a guy like me that's doing umbilical cord stem cells, which have no reactions and none of these. You don't need chemo, you don't need radiation, you don't have to do anything, just give the cells. You can have some very good results. Now, not all as good, maybe not as good as the ones that have been given chemo, but it's a lot safer. And so by knowing what you're doing, like going back to the farm, as a farm boy, you learn how to plant seeds and cultivate and make sure that there's no weeds and make sure there's fertilizer, etc. Same thing goes for the human body. If you have a human body that's been contaminated, you work in the sewer, you smoke cigarettes, you drink booze, you take all kinds of drugs, you work in a polluted factory, you don't care what goes into your body, pretty soon you got a lot of junk going on. And if you have chronic infections, all of those things cause poisoning, and the poisons get circulating throughout your system, and they affect the blood vessels, and that once they affect the blood vessels, that causes aging on the blood vessels. And when the blood vessels age, you start to age, because that causes hypoxia, lack of oxygen, and that causes what is called biological smoke, which is kind of junk cinders basically from unburned fuel, and those cinders then cause damage, and that causes the atherosclerosis, causes the cancer, causes the joint disease, etc. So you want to try to get rid of all that. And then once if you get rid of all the poisons out of your body as much as you possibly can, then take the stem cells, then you can have some very good healing results.
Is it specific to certain types of cancers and certain types of issues, or is it almost like an across the board?
It's an across the board situation.
Really?
If you talk, aging is related to infection, number one. If you look at the people that die the youngest, overall, generally, they have the most infections. The ones that live the longest in our world are the ones that never had an infection. Some of these people that are 110, 120 years old, they never had one day sick in their life. The ones that are dying at the age of 29 are the same ones that died at age 29 that were cavemen, because all cavemen, nobody had healthcare, nobody knew about dental flossing, nobody knew about health, and all these things. And so they wound up having a lot of dental problems and infections and these chronic infections, and poison your system, poison those blood vessels. So you wind up with this gradually increasing, where it's basically like an oxidative stress, metabolic stress. You're having a bonfire that's not burning brightly. It's got too many leaves on it, and you have nothing but cloud and smoke and cinders coming out of this bonfire, which is your body. So if your body is burning your fuel properly, and you don't have this biological smoke being generated, you age very slowly. But if you have a lot of biological smoke, because you're not oxidizing your fuel, which is your food, if you're not burning your fuel properly, you wind up with all this junk in your system, and that poisons you and causes aging.
So you have a unique phrase. The word doesn't really exist in it, youngering. What is youngering? I'm not familiar with younger. What is it?
Well, it's obviously to make you younger. And so there's no word there. We have anti-aging. My nonprofit was called the Anti-Aging Research Institute for many years. But no, people don't really, that sounds like, yeah, I don't want to get older. But if you're 80 already, you're already old. And so anti-aging at that point doesn't mean anything. But if you want to get younger and feel better biologically, then youngering is the thing that you want. You want to become younger. And this is the process of becoming younger. And so youngering is a process by which you take, like, for example, of all the things, I've treated thousands and thousands of patients with stem cells of all types, bone marrow, fat, umbilical cord, even embryonic stem cells. And into hundreds of thousands of vials of injections, and lots of bone marrow. 4,000 or 5,000 patients that I've treated with bone marrow treatments, which is taking bone marrow out of your hip and just putting it simply back into your blood. And you would think that, what does that do? I'm sorry to say that it took me a long time to figure that out, because what I did, I worked with Donnell Thomas at the University of Washington Department of Hematology in 1969, when he was doing his original bone marrow transplant work with leukemia and lymphomas and whatnot. He won the Nobel Prize in 1990 for that work. So at that time, it was quite exciting, but we were concentrating on cancer, leukemia, lymphomas, that kind of thing. And I did not think about using it for chronic disease like diabetes. Like, for example, that type 2 diabetes, you give 3 or 4 treatments of bone marrow to a type 2 diabetes, and the diabetes goes away. And so just, I've had people with total black blind, and you treat them with bone marrow, and they can see again in 4 to 6 weeks. So you can have people who are in wheelchairs get up and walk. I have on videos, if you go to YouTube, put my name in, and whatever condition, I probably have a video there showing you some patient who's gotten better from whatever it was. So macular degeneration.
You should have a line out to the, everybody should be at your door.
Well, unfortunately, when you're the first one to do anything, you get attacked by the medical profession. And so they make up lies about you, and they try to do what they can to destroy you. And so you wind up with I have a very checkered career, because I've done so many new things that the medical profession says that I'm a total quack job. And so they attack you. And when you read about me online, it's terrible. And yet I've never had, they did an investigation as part of that kind of stuff. And it's been a year and a half $1.5 million investigating me. Found every patient I ever had, every person I ever worked with, every person I ever knew, and they asked them about whether or not I was honest and a fraud or tried to ever cheat anybody, and they could not find one person that would make a complaint about me about anything. And yet they still went in attack.
I'm so glad about that, because I'm telling you, there are people who are desperate and need hope. It sounds to me like you are hope. That's what it sounds like to me.
There's no question about that.
Sounds like to me like you are hope. Now, there is something called Steenblock. I believe that's a product that you have. Do you have it nearby? Can you show it?
Oh yeah, I've got a bottle of this. Yeah, it's a it took me 3 years. I spent 300,000 developing this, so it's got a lot of science behind it, and I've used it now for 10 years in my practice. And basically, it gets into your system. You take it, and you take it at night. It helps you sleep, so it's like a sleep pill. And because your bone marrow helps repair yourself during your sleep, so regeneration usually is happening more at night, because as the oxygen level goes down in your blood, that stimulates your body to repair and regenerate, can you believe? And it induces a variety of genes called hypoxia-inducible genes, so that when you go to sleep, there's mechanisms of why and how you regenerate. By taking this at night, you help yourself sleep. It helps you go to sleep better, but it also releases more stem cells, so you have a better healing process in your body. So you can take, and now if you have a serious problem, you can do it. Now the bone marrow is interesting because it's like other cells in your body. It takes about 3 weeks for them to grow from one seed into a new blood vessel. So for example, with stroke, if I start treating you with stem cells or hyperbaric oxygen or whatever, you've had a stroke a year ago and your right arm is still paralyzed. I put you on the hyperbaric or the stem cells. It takes about 3 weeks, and about 3 weeks, 3 to 4 weeks, you say, the person says, well, wait, I got up this morning, my right arm, I could move it. And then a day later, I can move it more, and I can move it more. So it takes about 3 weeks for these new blood vessels to form. And that's the secret of rejuvenation. So you have to be doing whatever for 3 weeks. Now, so the point of that was that if you can get a whole bunch of these cells out of your bone marrow into your system, and if you have some kind of a blood-brain barrier opening, then there's a good chance that you can get some really good healing. So there's tricks to how to repair yourself that we help you with too. And so the Steenblock can be used for just, you take every night 1 pill, or you can take it 2 or 3 at night, or you can take, for example, if you really have, you're having some kind of plastic surgery, you want to get yourself healed up quicker, then you can take like 4 caps 3 times a day, 4 or 5 days. So heavy duty for 5 days. That stimulates the heck out of your bone marrow. You get a lot of stem cells flooding, and then you give it a break and let the bone marrow recover, because the bone marrow has exhausted its bone marrow. So you don't just keep hitting it. Say you do it for a few days, you get a lot of stem cells into your circulation, then you stop for a week or so, or maybe even 2 weeks, and then you do it again. When you do that, that's one heck of a program then, because you're really you're basically making new stem cells, allowing the garden of growth of the stem cells recover and make new ones. Because there's 2 kinds of stem cells in your body. The cells in the superficial part of your bone marrow that are making red cells and white cells every day, and then you have what are in the same areas, but deeper. They're cells that are not using oxygen. So the stem cells in your bone marrow that don't use oxygen. They're in reserve. They're like in the basement. I call them sleeping beauties. They're waiting to be awoken. And so if you have enough stress, like you give enough of this material that I give, you can help mobilize your own pristine virgin stem cells. And these virgin stem cells have their DNA is still intact perfectly. There's been no DNA mutations, et cetera, because they've not been metabolizing. They've been just sitting there waiting for your body. And so it's kind of it's an insurance policy your body has to preserve your DNA, because if your DNA is messed up because of the toxins and crud in your early life, if you could just get rid of all that, and by taking a product like this and move out the old, you get rid of the stuff that has DNA damage, and you now have cells that don't have DNA damage that are now in your bone marrow working. So it's a way of getting yourself healthier and making your old stem cells get out and put in new ones without having to have a real transplant from anybody. But you can do that same thing with actual bone marrow too. So you can and come to a guy like me who does bone marrows, I can take the bone marrow out, give it to you. And then, like, for example, I learned about this many years ago when I was treating stroke patients who didn't want to do umbilical, or we didn't have umbilical cord cells. And so I'd say, okay, let's do bone marrows. And I remember like a 182-year-old fellow who had a stroke about 2 years before came in, and we did a bone marrow, saw nothing, did it again 2 weeks later, he got a little better. 2 weeks later, another one, he got better. By the time we did 4, 5, 6, by the time we did 6, the guy had recovered from his stroke, and he looked at least 10 years younger. So that showed you that those old cells, when we got them out by doing constant bone marrow repair and putting back in growth factors, we stimulated the growth of the other cells, and they were able to grow better and do better. And that there's another point, is that your bone marrow is stimulated by walking. And so intermittent weight bearing on your long bones stimulates your bone marrow to make new bone marrow. So the more you lay in bed and don't get up and move, the less bone marrow you have, and the faster you're getting older. And so it's important to get up and walk and do things with your body to help these bones, keep these bone marrow stem cells healthy.
Wow. Wow. Well, Dr. Steenblock, you are all the way over in San Clemente, California. Are you by any chance participating in this online medical space where people can consult with you via like an online, like a Zoom conversation, purchase your Stemgevity? I mean, or is it that they need to fly from wherever they are and come to California and sit in your office?
No, we do telemedicine. Sure, there's no problem with that. Just like we're doing here, we have Zoom, and I'm familiar with Zoom, so that's not a problem at all. So if they have a Zoom and whatnot, we can connect that way, and I can prescribe pretty much anywhere. There's some rules about prescribing, but it turns out now with this pandemic, I can prescribe darn near anything anywhere in this country, and the pharmacists take care of it and all that. So we don't have any problem with that.
So unless they need the book,
they don't want to study, they don't want to learn, they want to just be given something, a pill, and have it all magically happen. And so it does take understanding and cooperation between somebody like me and yourself, because you just can't expect that you come in here with Parkinson's, for example, and expect to get a shot of stem cells, and it's going to work 100% of the time. Now, if you do everything right, you'll have a much higher chance of success with whatever you have stem cells, because, like I said, they're interfered with by infections. They're interfered by heavy metals. So it's just like being pregnant for the first 6 weeks. You don't go out and eat tuna. You don't smoke cigarettes. You don't go to the gas station and breathe the gas fumes. You avoid gas fumes. You avoid toxins. Why? Because your baby is just forming, and it's very sensitive to all these toxins. Your body, when it's using stem cells, is doing the same thing. It's making new tissue, and that new tissue is vulnerable to all of these poisons. And if you have these things in your system, that can just stop everything and prevent you from getting the repair that you want. So it's a complicated issue, but it's very rewarding because you see such great results if you do everything right. If you don't do everything right, then you're upset because you spent time and money and you didn't get the results. And so then and that happens, and you'll see that stem cells don't work 100% of the time. I'm working on why that is, besides what I mentioned, the heavy metals and the toxins and everything. There are other things in the gut, what I believe are causing that, and they're called small intestinal uremic toxins. And these are small molecules that are toxic to the blood and the bloodstream and the stem cells, and they interfere with the endothelial functioning so that the capillaries don't work, and you have leakage, and that causes leakage through the blood capillary into the brain, causes Alzheimer's, for example. So they just published that lipoproteins binding to toxins from the liver circulate and go to the blood-brain barrier and cause the formation of amyloid and tau and all that kind of thing. So these things are now we're just starting to learn all about all these little intricacies. Most doctors have never heard of any of that stuff because it takes study, and you got to really work at learning all this stuff, like this neurovascular unit. I'm sure that 99.99% of everybody that listens to this has never heard of it, but you can go to Google neurovascular unit and read about it and see what I'm talking about, because it's the latest and upcoming thing in terms of how to stay healthy. You have to learn about that whole setup right there, because those things control pretty much everything about what happens to you. And that's the pericytes in there, and pericytes a stem cell. And so we can repair that by using bone marrow treatments, and we use fat stem cells to help repair that. So, and then we try to get rid of it, the old ones that are not functioning well, through what it's called senolytic therapy, or taking out the old senile cells, because these cells become old, and once they become old, they start becoming inflamed and start putting out inflammatory cytokines, which cause more damage. So you want to get rid of anything that causes you to have damage, any inflammation in your system. You want to get rid of any infections, any heavy metals, etc. The gut microbes that are causing toxins. All of these things, air particulates, diesel fuel particulates. Diesel fuel particulates following a truck on the road with diesel, one of the worst things you can ever do. And the actual diesel particle is the most toxic thing in the air, that generally, other than breathing a fire, smoke inhalation kind of thing. But on our normal daily existence, diesel fuel is very toxic. And for example, I've seen amyotrophic lateral sclerosis patients who have one. I remember bought a truck. He was just in his early stage of his ALS deterioration, and he bought a diesel truck, and he just went choo down. And I started talking to him, I don't know, after about 6 weeks or 2 months of him having that diesel truck. And I said, get rid of that damn truck, and he did. And I talked to him then a month or so later after he got rid of it, says, yeah, I'm a whole bunch better. So just getting rid of that truck really improved that patient with ALS, because that's a disease of that neurovascular unit, but it's of the spinal cord. And so that's where that's at. So I have a lot of ALS patients, because I always like the most challenging cases, and they're the most challenging that there are.
Wow. Dr. Steenblock, normally these shows are 15 minutes, but I really am going to preserve everything you've said, because I think people need to hear what you've said. And I think you're offering a level of hope for people, like people with ALS, people with stroke, people with Alzheimer's. I mean, honestly, these are the forgotten, the write-offs that the doctors say, you're just waiting to sign the death certificate, so to speak. And it sounds like there actually is some hope. And I'd be the first one to say, if any of my parents had this issue, say, hey, we're not going to just take it just because, let's go get another opinion. Let's go get a Dr. Steenblock opinion. So
yeah,
guys,
give me a call. I'll give you a free 5-minute consultation.
Yes, I do want you to tell us how to get in touch with you.
It's my phone number is 949-367-8870. 949.
I'm going to put it in the credits.
Yeah. My website is strokedoctor.com. Just plain strokedoctor.com, all spelled out. That's about it.
I'm going to write it in the credits at the end.
Okay.
So people can, they won't have to worry about figuring out their phone number and all that. I'll put it there.
Okay. All right.
Wow. Well, Dr. Steenblock, I really appreciate you being my guest today.
Well, thank you for having me.
Giving people hope. That is like huge. That is huge. So thank you so very much.
Thank you very much.